Next, I'd like to speak to you about stopping smoking. Very important, the single most important lifestyle change you can make to decrease your risk of cancer or cardiovascular disease. There's the culprit right there. So, to pass the questions on smoking cessation, it's good to know the 5 A's. All right? On every patient visit, ask the patient about smoking. Okay? If they smoke, every single visit, advise them to stop smoking. You have to talk with them and attempt to find out what they've done in the past and give them information and assist them and give them recommendations of how to stop smoking in the future. And then you need to arrange for follow-up discussion. And if the patient fails in their attempt to stop smoking, you need to be encouraging and ask again and advise again and repeat the whole cycle the next visit and try something else or try again to stop smoking. It's that important to patients' health. All right? Now, people do try to stop cold turkey by themselves. I can do it. I can stop smoking. But this technique is rarely successful. All right? The brief counseling by the physician, by you as the healthcare provider, is efficacious and is a very important part of the stop smoking strategy. All right? Now, there are 2 drugs on the market to help patients stop smoking, and they have a good track record. They do work. One product is nicotine in any of its formulations. It comes as a spray under the tongue. It comes as a throat lozenge. It gives you the sensation of something in your mouth instead of the cigarette. It comes as gum. It comes as a nicotine patch. But if you can use nicotine by asking the patient to set a stop smoking date, and then they don't use any more cigarettes, but they use the nicotine instead, and then wean off the nicotine. The second medication that is useful for this is bupropion, which is marketed under the trade name of Zyban for stopping smoking. This drug is marketed under the trade name of Wellbutrin if it's used for psychiatric illness, but it's the same medication. The problem with this medication is that it is not indicated in patients that have a history of a seizure disorder. So encourage your patients to stop smoking and do it every visit and keep trying, because it's the single most important thing you can do to prevent disease and death. That's the end of the stop smoking section.